is Kelly with Norman Regional. This month, the health system is doing a series of Facebook videos focusing on mental health. We really want to change the conversation about this issue, stop the stigma, and help people really get the resources and the information they need to get better. So here to talk about that today is Dr. Farhan Jawed. You're a psychiatrist, and you're also medical director of the Behavior Medicine Services here at Norman Regional. So you work with this group a lot, this population. What are some of the issues you are seeing them deal with as far as mental health goes?
Well, mental health challenges can happen in any age group, but we often see that our aging population, our older adults, are dealing a lot with loss. There is change in lifestyle. They may not have the same family, friends, and loved one who used to be with them. Over a period of time, there is a degree of loss that affects them. Another aspect is that they are not as strong as they used to be. As they age, there's a decline in physical and mental health that also affects your ability to work and ability to do your daily life activities that you used to in the past. So that also affects your mood, and that in turn can affect your activity level as well. Another aspect is that as we age, we are going to have some memory problems as well. So when somebody is struggling with those memory issues, in turn, that affects their mood as well. That can cause depression and anxiety. So it's kind of a circle where one thing affects another, and it goes on from there.
So what are some signs of depression that we need to look for in our loved ones?
Well, actually, it depends upon the severity of the situation. Sometimes depression can be as simple as a symptom. For example, in case of a small loss or tragedy, one can be depressed for a short period of time and then they can get better. However, in some circumstances, the symptoms become more significant and they get prolonged. So we often see that people who are struggling with significant depressive disorders, they will have changes in their life routines. They will feel lack of energy, focus, concentration, desire, motivation. There'll be increased tiredness. They would not enjoy their usual activities that they used to. Their sleep and appetite can go up and down. Feelings of guilt can set in, and in certain circumstances, people can have suicidal thoughts as well. So when you have this syndrome of symptom developing, then it is called a major depressive disorder, and that is your sign that you must go and get appropriate help.
This generation isn't really one to ask for help. So if you do see those symptoms in somebody you love, what are you supposed to do? How do you encourage them to get to this help that they definitely need?
Well, that's a very important question, because when you are an older adult, you always feel that you have seen it all and you have done it all. And it's difficult to assess yourself. So self-awareness is not there all the times. So when you have family members around you, they can usually see and they can tell that you're not your usual self. So anyone who feels concerned about a family member who's struggling with any mental health issues, I would say they can very politely explain to them that this is what's going on and you are not the usual self you were, and then encourage them to get help. So an empathic way of explaining the situation often works.
Okay, I'll have to remember that.
Yeah.
So you're also in charge of the Senior Counseling Center
Yes.
that Norman Regional runs, and it's really a one-stop shop for all these issues that you're talking about. So explain some of the services that we have.
Well, actually, we are very fortunate to have this facility here in Oklahoma at our Norman Regional Health System's Moore Medical Center complex. We have our Senior Counseling Center. This is an intensive outpatient counseling program. And the benefit is that here we provide intensive outpatient counseling in the form of group counseling sessions and then individual counseling as well, which is provided by licensed clinical social workers and therapists. At the same time, the patient gets to see a board-certified psychiatrist, which is usually myself, and they get psychiatric evaluation and psychotropic medication management as well. So while we are providing these clinical services, we understand that time and commitment is important. So to facilitate our patients, we have transportation services which are free of cost. Our buses go to their homes, we pick them up, bring them here, and we also provide them with lunch, which is free of cost since they are here for a few hours, and then we drive them back home. So we not only provide the clinical services, but also these transportation and food services to facilitate the patients.
That is a really, really great service. About how many people do you think are taking advantage of that right now?
Well, right now on daily basis, I know that there are at least 20 to 30 patients who come for these services. We have two programs. They either come in the morning and then they do their counseling sessions and have their lunch and they go back, or the people who come in the evening sessions, they come, they have their lunch and then they have their counseling sessions and then they go back home.
So there's some flexibility there. You can do the morning and the afternoon.
Absolutely, depending upon their schedule. We try to facilitate people as much as we can.
Okay, great. Thank you so much. This has been some really good information. Thanks for watching. We hope you learned something. Please like and share this video so other people can learn about the mental health resources available in our community.